This is where we learned that Mark Jorgensen would be the first Utahn treated for COVID-19. However, he did not spread the virus to anyone else. There's not much that can stop Mark and JERRI Jorgensen from enjoying their lives.
Hi!
Yay!
The St. George couple goes mountain biking 4 to 5 times a week and are planning their first trip out of the country since last year.
I'd say I have a little nervousness.
Nervous because they have to test negative for COVID-19 before returning, and they are still seeing the effects from the last time they traveled.
And so I go back to my gym, to my Pilates class, and then I get a call from the manager of the gym. Says, we don't want you to come back.
JERRI says she's even received death threats on social media.
You come here, we will kill you. I think that's kind of a death threat. So the sheriff, Washington County, he called me and he says, you put my number on speed dial because I know about these threats.
All because Mark and JERRI were the first few from Utah to contract the coronavirus while vacationing on the Diamond Princess cruise ship in Japan. The couple was selected for testing on the cruise because Mark is considered high risk from kidney transplants. They didn't think JERRI would be the one to test positive.
Kind of got real in that moment. They had this printed sheet and just handed it to us and says, because of your test results, you'll be taken off the ship.
JERRI was driven in an ambulance to Fukushima, 4 hours away. No one spoke English.
Some people were actually quite appalled that I would have the audacity to get off and go back to America while my wife was in a hospital in Japan.
Well, did you have much choice?
I kind of did. I mean, even if I could go to the hospital, we wouldn't see each other.
One airplane.
A cargo plane is what brought Mark and 170 others back from their cruise. He had not tested positive, but Mark believes it was on that flight home that he got COVID.
Okay, we are 9 hours into the flight.
Not something I'd want to repeat.
Once back in the States, Mark tested positive. He wasn't showing any symptoms, which was a huge factor in the decision to transfer Mark to a biocontainment unit here in Utah.
Good evening, everyone. It's great to be with you again.
Do I really sound like that?
Yes.
Geez, that's weird.
Here I am in a Japanese hospital. I don't know the name of it. None of the doctors speak English. We communicate with an iPad.
Although they were continents apart, the couple says they never felt truly alone.
When I got that clearance that I could leave the Japanese hospital, and they stood out, and I got in the Uber, and we had to go down a ways before we made the turn, and they just kept waving. And it reminded me of my mom. It was so sweet. And, they just stood there and kept waving, and they were crying, and I was crying, and that was really spiritual, and it was so heartfelt. And if I hadn't have gone through it, I wouldn't have ever experienced anything like that.
Sweet memories amidst the chaos of their trip.
Come on in, special guest. Okay, yay!
Hi.
It's my lovely wife, JERRI.
Did you hug when you first saw each other?
We couldn't.
You could.
They told us not to.
We were
should
like I
have.
said, we were more compliant. I was out mountain biking first morning I got back.
Back home and back to life as they knew it. Well, almost.
I've got this brain fog happening.
That, and Mark says he's been having issues with his vision.
The nerves from my eye to the brain are kind of squished. It is affecting my peripheral vision that my eye doctor is convinced is due to COVID.
Yet, in spite of it all, not even COVID-19 could stop the Jorgensens from living life to the fullest.
Life itself is a calculated risk.
We always can choose in whatever circumstance we're in. We almost have choice. We can choose fear, we can choose love.
Mark and JERRI tell me they are in Costa Rica tonight on their first vacation out of the country since 2020. From the Intermountain Medical Center in Murray, ERIN Cox, Fox 13 News, Utah.
Thanks so much, ERIN. Now, since treating Mark Jorgensen last year, Dr. Todd Vento with Intermountain Healthcare says they've learned a lot about COVID-19. Dr. Vento says he learned from the CDC that Jorgensen could come out of isolation once he was not going to spread the virus to others. The CDC told Dr. Vento that was okay per their new approach to the virus at the time. He says doctors have come a long way over the past 12 months to contain and treat the virus outside of isolation methods.
So scientific explosion of knowledge and what to do from pre-exposure, after exposure, early monoclonal antibody for outpatients to prevent admissions and severe disease, what medicines to give in the hospital to prevent going onto the ventilator.
Dr. Vento says other major factors to try to control the spread of COVID-19 are mask wearing, social distancing, and now getting your COVID-19 vaccine.